Today we are going to talk about endometriosis in yet another live session of ours. Hi, I am Dr. Nilesh Balkawade, Clinical Head Oasis Fertility Pune. Endometriosis is a very distressing disease and it's bound to recur. What is endometriosis? Endometriosis is ectopic occurrence of the endometrium outside its normal presence within the uterus. Endometriosis can occur anywhere, right from the skin to the ovaries or in the abdomen. These are the sites where it is commonly seen. What are the symptoms of endometriosis? Dyspareunia, that is difficulty during sexual contact, is a very important and distressing symptom. Dysmenorrhea, that is a painful menstruation, is another very important symptom. Dyschezia or pain while defecation is another important symptom. Infertility or inability to conceive is another symptom of endometriosis, which is commonly manifested to us as infertility specialists. Let's see how we can diagnose endometriosis. First and foremost is the physical examination. So sometimes physical examination, history taking and the clinical examination can tell us about the telltale signs of endometriosis. Second and most important diagnostic measure is ultrasonography. A nicely done transvaginal ultrasonography is a very important step in assessment and diagnosis of endometriosis. Transvaginal ultrasonography can detect the different forms of endometriosis, whether the involvement of rectum is there, the involvement of the urinary bladder is there, and so on, or if there is an involvement of ovaries, it can be detected on the transvaginal sonography. If it is a deep infiltrating endometriosis, that is endometriosis is spreading into the depth, that can be detected by magnetic resonance imaging, that is the MRI can detect this. The gold standard of diagnosis of endometriosis, age-old, is considered as laparoscopy. So laparoscopy can be done and endometriosis can not only be diagnosed but also treated in the same setting, and the lesions can be sent for histopathology to confirm the diagnosis. Let's see about the treatment of endometriosis. Patient of endometriosis can come to you for different reasons. One can be a distressing symptoms such as pain, or the second reason, which is common, is infertility. If the patient is suffering from pain and if there is no consideration for the childbearing, in that cases the endometriosis can be suppressed by a variety of medicines, that is tablets such as Dynogest, oral contraceptive pills and so on, or even injections used for suppressing the menstruation can be used, such as the GnRH analogs. Along with that, there are certain devices which can be placed in the uterine cavity which can help in reduction of endometriosis and adenomyosis. These are the progesterone intrauterine devices. Surgery is also an important aspect of treatment of endometriosis. If the pain is severe and the endometriomas are large, they can be removed via surgery, and this can help in pain reduction and also help in improving the fertility. Let's see about the treatment of endometriosis in infertility. If the endometriosis is mild, that is grade 1 or grade 2 endometriosis, this can be treated by ovulation induction agents and not wasting much time and following up the patient regularly. If the patient is not conceiving, the patient can be shifted to the treatment of controlled ovarian stimulation and intrauterine insemination along with that. If the patient has had a previous surgery for endometriosis and there is a recurrence of endometriosis, these patients are at high risk of developing a low ovarian reserve. The chances of conception fall down, and therefore these patients can be, if they have a long-standing history of infertility, can be taken up for in vitro fertilization techniques, where the success rates can be improved by aspiration the follicles, making the embryos, and before the transfer of embryos, again down-regulating the endometriosis and then putting back the embryos inside the uterine cavity. So friends, this is about the symptoms, diagnosis and treatment of endometriosis. If you have any query related to endometriosis, please connect to us on the helpline number given below. Thank you.